Good day, everyone, and welcome to our Bonita's Maternity Program webinar. Today, we're with Sister Ingrid Groenewald, who will be speaking to us about pregnancy niggles and why it's good to have them. So welcome, Sister Ingrid. I think you can unmute yourself, and the floor is yours.
Right. Okay, fantastic. It's so nice to be with you again and with all the pregnant moms and possibly dads, who knows, or anybody who's perhaps interested in being pregnant and is starting to do their research. So first of all, yes, I'm happy to be here with you and to spend the next couple of minutes with you. So it's always an interesting topic to talk about pregnancy niggles. Why do we have to have these funny feelings sometimes and things that happen in our bodies? And it's important to understand why that is and why, in actual fact, you should be really happy to have them. It's really great to think that your body's working and your hormones are really working. So let's start with the first one that is a very common pregnancy niggle that a lot of people battle with in the first 12 weeks in pregnancy, and that is just plain nausea. So some of you might have it, and it is always weird to think why some people actually experience this and other people don't even know what we're talking about, So with all these niggles, people are all individuals. I think that is important to remember. But if we think about nausea, that is quite common in the first 12 weeks. It's a very hormonal time in your life where the hormones change a lot. And so for the first 12 weeks, it is quite common to feel suddenly you off on certain foods and you don't like the smell of even red meat or anything that is raw, or just certain triggers that just trigger you and you think you can't have that, you can't smell that. And that is quite normal. You're quite normal with that. What works for that is to actually eat small, frequent meals. And I think this is one of the biggest problems that people experience is that they think that if I eat something, I'm going to be nauseous. So I'm rather not going to eat something, but that empty stomach is actually worse. So by trying to keep on eating small little meals just to have something in the stomach is actually the ideal. And a little tip here from me to you today is to actually have like a box of little biscuits, Marie biscuits, tennis biscuits, things like that, next to your bed. And when you wake up in the morning, before getting out, just eat one of those biscuits. Usually after a couple of minutes of just eating that and then just lying still for a little bit, if you get out of bed, then most moms actually say that they actually feel okay. So the nausea is quite a common one. And then the next one is heartburn. Okay, so we have to be, perhaps before I go into that, if we think about our hormones regulate our bodies, and when you're pregnant, there are lots of different hormones working in. And I want to point out two hormones because most of the pregnancy niggles are related to those two hormones. The first one is progesterone. And that might have, that might ring a bell, perhaps, in the sense that you might have heard of that before. So progesterone, and then the other one is called relaxin. So those two hormones work together. And actually the second one is almost pointing you in a direction as to what to expect, with that hormone. So relaxin, the name, it actually means it relaxes something. Okay, so now let's go through the pregnancy niggles. The heartburn is quite a common thing that people experience later in pregnancy. Some experience it already early in pregnancy, but to try to explain is that your stomach has a little sphincter. It's almost like a little door at the top. If this is my stomach, at the top you've got a little sphincter, a little opening, a little door that opens if you swallow and it closes again, okay? Now, suddenly, if you're pregnant, these hormones affect a lot of our systems, a lot of our different parts in our bodies, and it also affects that little sphincter, where that sphincter can't actually work 100%, so any kind of pressure from the inside actually opens it easy. So that is why if you eat something and you go lie down, or you eat something really spicy and your stomach really has to work, then suddenly you've got pressure from the inside and it actually opens, or it can actually easily open that sphincter, and then suddenly it pushes up, the acids push up, and then you're experiencing the heartburn. So that is definitely something that a lot of people do experience in their pregnancies. And then also the same thing goes with your bladder. If you think about your bladder, the same thing, same explanation. The bladder has a little sphincter at the at the top or at the bottom of the bladder to actually, that you actually don't wee all the time in your pants, for example. But now the thing comes in, and perhaps some of you have already experienced this. In later pregnancy, at the end of pregnancy, suddenly you laugh suddenly, or you have a sneeze or a cough. It's quite common to suddenly feel like, oops, there I weed in my pants, because the reason for that is the same. These two hormones, the relaxin and the progesterone, they work in on that sphincter. And then it's so easy just to open up, anything that normally would never do that, sneeze suddenly. It's easy just to suddenly just open and close again. And then you have like these little mishaps that actually happen. Okay, so this is quite normal to have that. And here I want to point out again, if you have weed in your pants, you must actually say, oh, this is fantastic. I know I'm pregnant. I know these hormones are working in my body, and because these hormones are really needed to really function as well and properly at birth, So if I know I've weed in my pants, I've got the heartburn, my bladder's giving me problems, you must in actual fact say, fantastic. I know these hormones are with me, they're there, and they will be with me when I also have my baby. Okay, so those are the very common kind of niggles that people experience. The next one I would say is backache. Okay, so backache, we know as you go further in pregnancy, most people start to complain about their backs. Their backs are really painful. And here perhaps I need to stop you and to say, go stand in front of the mirror and just have a look at yourself. In what position? How do you stand? What is your posture like? Because in most of the cases, it's a postural kind of thing. Because as the pregnant belly is growing and the weight is growing, the baby's getting heavier, we tend to lean backwards because the tummy goes forward. And then sometimes you even have the head going slightly forward. And then all these muscles, the lower back muscles, they actually start to take strain. So it's important to stand straight. So perhaps look at yourself every time you walk past the mirror, stand in front of the mirror and just look at yourself. How do you walk? Okay. And even how do you sit at night when you're relaxing, when you're watching TV? How do you sit in front of that TV? If you sit leaning backwards, in a chair or in the sofa, it's likely you might actually end up with some back pain. So rather sit straight. Okay, we want you to sit straight with these muscles. Okay, so that is definitely, it's often a postural thing. And then also, again, these ligaments. And remember that we've got ligaments all over our body. Ligaments become a little bit more stretchy in pregnancy. And here I want to basically just bring out my pelvis as well, if I can show you. If this is your pelvis, and it's quite amazing to think how our design is to think that this can actually work really well and open up bigger for this baby to be born on the baby's birth date. What happens is that this pelvis, when you're not pregnant, it looks like one structure, and it is really one structure. But it's actually different bones. So you have a bone on this side and on that side, and then also you've got the spine coming up. But these bones are really glued together by ligaments. And when you're not pregnant, these ligaments, for example, here in front and here, to actually glue together, they're as hard as bone. So it really is one structure. The thing comes in, once you're pregnant, suddenly you've got these hormones working, and then these hormones affect the ligaments that they become a little bit more stretchy. And I just want to show you, if this is normally one of the ligaments, you also have ligaments under the, that is sitting like this under the uterus, and they're normally hard as bone. But now suddenly this can actually start happening. Okay, so because these ligaments become elastic. Okay, so if you sit for a long time and you suddenly get up and you turn to the side, you sometimes have this immediate stitch in your lower kind of almost groin area or to the side of your tummy lower down. And it really is the ligament that suddenly does this. Okay, so it's nothing abnormal. It's in actual fact just a ligament that tells you, yes, I'm here, I'm more stretchy, and I'm preparing for birth. Okay, so the ligaments are definitely a lot more stretchy. And if I come back to the pelvic bone, why do you think is it important that these ligaments become stretchy? Okay, is that if we think, you know, that a baby has to be able to move down the pelvis and through the pelvis. And this is where it is important, if you have listened to some of the other previous talks, is that the position that you're in at birth is quite important, and what you do. We know that certain positions, if you squat or if you sit with your legs apart, or you sway, or you do certain things, it actually opens this pelvic inlet and the outlet. So it actually opens, because these ligaments are stretchy, it can actually open bigger. It makes it way easier for the baby to be able to move through. Okay, so that is why we have to have ligaments that can stretch. But unfortunately, the hormones work on all ligaments. It's not just the ligaments in the pelvic bone that are affected. It's all the ligaments. Okay, so you've got these ligaments. Like I said, you have the ligaments on the side, lower down. You've got them, and the uterus is really resting on top of these. It's like elastic bands to just hold the uterus. That is affected, like I said. And then also, another interesting fact is that if you think about your boobs, and you can perhaps tonight when you go and bath, just have a look at yourself. What do you look like? What do your boobs look like? You know, they have changed quite a bit in pregnancy. And what we know is, yes, they are growing, they're getting heavier, they're preparing for breastfeeding, but also that you've got ligaments inside of the breast that is there. And these ligaments are also affected by the hormones. So they become a little bit more stretchy. So do not worry about drooping breasts or hang titties. I don't know what you call that in English, but it's very, you know, if you understand what I'm talking about, a lot of people worry about getting these hang titties, or, you know, the drooping breast or the very sagging breasts. It has nothing to do with breastfeeding of your age and things like that. It has 100% to do with the hormones that actually work into these ligaments to be able to make them more stretchy. And yes, don't worry, you have certain exercises and things that you can do to help with that. But that's a whole different topic on its own. Okay, so the ligaments really work all over in your body. If you think even about your feet, you've got ligaments between, interacting or around the foot area, the knee area. And we know that exercise is really good in pregnancy, but it is also really important to take care of yourself, because these ligaments are quite stretchy. So it is much easier to walk and to suddenly hurt yourself and your ankle. So it is important to have flat shoes on and something that really supports the ankle, you know, like tekkies if you're exercising and walking and so on. Okay, so that is another pregnancy niggle, is these ligaments that become so stretchy. Then another huge problem that people experience and that I often deal with is people that start to say, you know what, I think I'm getting hemorrhoids, you know, or I'm really constipated. Now, perhaps you're sitting here today and you think, yeah, that's me. And, you know, it might be a topic that you don't feel comfortable discussing with someone else, but it is quite real and it's quite normal. Okay, so there's nothing wrong with you. What happens is that, again, these two hormones, the progesterone and the relaxin, they also work on a lot of different things, like the colon is affected, where normally the colon has like a peristaltic movement, where it has this movement, it keeps pushing everything to the front. So it has this normal movement. But now suddenly in pregnancy, these hormones affect the colon. So the movement is slowed down quite a bit. So it's still moving, but it's taking longer. Okay. So now what happens, your body has more time to absorb the liquids or the water actually in the stool, and then you end up with constipation. And so it's quite a common pregnancy niggle, and a lot of people, because of that, actually develop constipation, or obviously constipation, but also hemorrhoids. Okay, so what we can do here is to make sure to look at your diet. What are you eating? Trying to go for the high fiber foods, trying to avoid any food that is a potential thing on its own, if you eat a lot of that, to actually get constipation. So you want to look at your foods, your fruits, your vegetables, and then by drinking lots and lots of water. And then here to get together with that is obviously by exercising, by walking on a frequent basis, or by exercising more, is really good. So constipation and hemorrhoids, again, quite a normal thing to happen. And it is, it's again, if you've got it and it's not great to have it, you must just say, yay, I've got this. I've got constipation. I know these hormones are in my body, and they are preparing me, and they're preparing, my body to be able to birth my baby. This is really the end goal at the end of the day, is to actually have your baby. And I brought my baby along, which is baby Erica. And I just, we all do this. It's amazing to think that we do this pregnancy. We go through the stages, through the niggles, to eventually end up with your baby in your arms. Okay. Another concern or niggle that a lot of people have is the weight gain that actually happens. And here we if you look at the theory, it reckons around about, let's say, 12 to 13 kilograms in the pregnancy. And it's basically, the aim is 1 to 2 kilograms in the first trimester, the first 12 weeks. Then the second trimester, it's about 6 kilograms that you gain. And then the last one, about 5. But I must say, most people do go over this a little bit. Okay, now is not the time to really be on a diet, but it is a time to try to eat healthy. Okay, but weight gain is important, and it's not just gaining fat in your body. If you think about your pregnant uterus, how bigger the uterus is, it weighs something. The placenta, or the afterbirth, weighs something. The water where the baby is in definitely has a weight, as well as the baby. And we know as baby gets bigger, the baby actually starts gaining a lot more. So we do expect weight gain. So definitely that is quite a normal thing to experience, is weight gain, and that you later feel you don't have clothes to wear anymore, because nothing fits really that's in the cupboard. Okay, another niggle that people have is cramps in pregnancy. So you might have experienced that, where you go to bed at night and you wake up at 2 o'clock or 3 o'clock in the morning, almost jumping out of bed because your calf muscle is cramping. Okay, so for those of you who have experienced this, definitely know what I'm talking about. Okay, so that is very uncomfortable and really painful. And it all has to do with circulation, because when you're lying down at night, your blood circulation slows down. And then it's quite common in pregnancy after a couple of hours of lying still, then suddenly, you start having cramps. And it has a lot to do with magnesium. You have to look at your supplementation, what you're taking, what are you eating. A lot of moms find by eating a banana perhaps before bedtime actually helps, because then it actually helps to prevent or not as severe cramping. And what you really do, if this is my leg, if this is my calf, you basically just flex your foot. Okay, it just helps to just stretch out the calf muscle at the time, and then it actually helps. Okay, and then also this is where your partner comes in. Lots of rubbing, lots of massages, perhaps leg massages before you go to bed at night. So that is a really good one. Okay, so cramps, definitely quite common that people experience later in pregnancy. Then another one is stretch marks. So who has stretch marks? And some of you might have already got lots of stretch marks. And I've heard the other day somebody said to me, she sees it not as stretch marks, but it's a way of communicating with her. It's like Braille, the language, this what you feel, because the baby is communicating with her. And I thought that is actually a really good thing to think about, because at the end of the day, it's your baby who's growing. And yes, it's the skin as well that is now really starting to stretch. And also what happens quite often is a lot of people start to experience a lot of itching together with that, because as the skin needs to stretch like this, especially at the end of pregnancy, itching can start quite a bit. So by making sure that you're actually putting some cream on every morning, every night, some stretch mark cream or stretch mark tissue oil also works well, and you can just put that on, and that actually helps with the itching, and then also helps with trying to prevent any kind of stretch marks, or that it's not too bad. Okay, so that is the stretch marks, which also happens. And then another niggle that a lot of people complain about really is sleep, or the lack thereof. Now, this is important to remember, that it is really a good idea to start waking up at night. You know, if you think about it, this is your body's way of preparing you for your baby. If you would have these fantastic nights sleep every night, you get into bed, you sleep, and you wake up refreshed the following morning, well, if you can still do that, that's fantastic. But most pregnant moms do find that your bladder is starting to give you all to chase you out of bed early hours, and every now and then just to go and wee, and then sometimes you're on the toilet and it's just a couple of drops, but you know, you really felt like you had to go to the loo. This is your body's way of starting to prepare you to actually wake up at night on a frequent basis. It would be very hard for us as women if you suddenly become a mom and you have this newborn baby and you have to actually wake up every now and then for a feed, because we know newborn babies, they feed a lot in the first couple of weeks. So it would be very hard for us if you're not aware, or if you haven't really practiced basically of waking up at night. Okay, so you must say, thank you, body. Thank you, hormones, and my bladder that is starting to chase me out of bed every now and then, because you're helping me. So, okay, so you are preparing for the birth of your baby, and you are preparing for your your baby, and also for the feeding afterwards. Another thing that I also want to mention here is a low blood pressure. This is another thing that a lot of people do not struggle with, but they definitely notice that their blood pressure is lower than what it is normally. And the reason here is, again, these two hormones, the relaxin and the progesterone, they work in on the blood vessel. Okay, so the blood vessel, if it's a low blood pressure, what happens, the pressure is lower within the blood vessel, okay? And if you have a high blood pressure, the pressure is higher. So there's a lot of constriction taking place at that point. So with a low blood pressure, these hormones affect and it relaxes the blood vessel, okay? And that is why your blood pressure is lower. Quite normal to stand up and you feel like you just have to stand a bit, because suddenly the world is spinning a bit, and then after a while you can actually continue your to walk or whatever you wanted to do. So that is also quite normal. Okay, so again, these two hormones, if we look at all these niggles, straight from nausea, heartburn, constipation, hemorrhoids, cramps, basically the itchiness, the sleep even, everything is somehow connected to these two hormones, the progesterone and the relaxin. And so if you experience this is not a harmful thing to have. It's not dangerous to have. At any point, if you have something that you really worry about, by all means, contact your care provider to just make sure everything is fine, or perhaps write this down so that you remember to ask your care provider at your next appointment. But if you feel these kind of things, you must really be happy about it and say, it's fantastic. I've got these hormones. I know these hormones are working in my body because I have all these issues. You know, I cannot sleep. I'm weeing in my pants all the time. I've got backache. I've got nausea or heartburn. And it's perhaps not great to have it at the time. But luckily, we are pregnant only for a certain amount of time, and it actually stops once your baby is born. Then suddenly, and the hormones prepared your body for the birth of the baby. And once baby is born and you have your baby in your arms, then all these niggles stop. Okay, so that is really great to know. Okay, so I hope the rest or the remaining of your pregnancy is going to go well. And if you experience this, remember, enjoy this, okay? And tell someone, I'm so happy I've got these hormones working because it's preparing my body for the birth of my baby. I hope this helped you today, and you must have a lovely day forward. Thank you very much. Any questions? If somebody has questions, also is the time to possibly ask them.
We do have one question. This lady is 6 weeks pregnant and she just needs a home-based remedy for heartburn. She's taking some medication that she thinks is escalating the heartburn. So is there any home remedies that she can use?
Yeah, again, like I said before, with heartburn, what we want is to keep something in the tummy all the time. So it must never be empty completely, okay? So usually by having some biscuits that you just eat just a bite or two in the morning before getting out of bed. And then also you can drink ginger tea or even peppermint tea. That also seems to work quite well. And then the tissue salts, you get tissue salts that you can find at the pharmacy. And that is the number 8 tissue salt, the Nat Phos tissue salt that actually also works quite well with heartburn as well as nausea. So for those kind of things. So it luckily is something that in most cases, around about 12 weeks, that stops. So it's not long to go and you will definitely start to feel better. So I can just quickly say here that, your vitamins are quite important. Make sure that you drink your vitamins in pregnancy. And even by looking at the tissue salts, by the homeopathic remedies, there are a lot of things that homeopathically is really useful in pregnancy, like the tissue salts. And you get different ones for different conditions. And normally if you stand there on the actual bottle, it will say what it is for. And it's really safe to take in pregnancy, and it will not affect your baby negatively at all. It will just help you to actually feel better with certain conditions in pregnancy.
I'm 26 weeks and still dealing excessive saliva. My gynae has not prescribed anything for it. Is there any remedy you can suggest?
With that also, if we think about even blood supply, there's so much more going on. A lot of people talk about saliva. Some people say that they feel congested, or you brush your teeth and it's bleeding more often, more frequently, like before it didn't do that. It has to do with the circulation as well that is increased, and it's more in pregnancy. And so it's actually not a bad thing. It's not a problem to have it. You can, I think just by drinking lots of water, and even here you can also go for the Nat Phos, the tissue salt number 8, that will also actually work on that. So, or that might actually help for that. But I don't think you need to stress that it is a problem that you have to look at to actually take medication to make it, less even. It is something that will actually disappear once your baby is born.
Okay, we have another question. How to prevent UTI? I have a history of UTI, and even now my doctor put me on antibiotics.
Okay, that is also, I didn't mention that the UTI is also, and that's to do with your bladder. That is a urinary tract infection, and that is quite common, more common actually in pregnancy compared to not being pregnant. So some people have experienced before, but in pregnancy it's more likely to also have it. And it has to do with by drinking water. What you want to do is just by flushing your your body, just by flushing the bladder, by drinking at least 2 liters of water a day. And perhaps if you think about yourself, how much water do you drink? And even if I think about myself, I think, oh, I'm not on a liter already, and we're in the middle of the day. But it is important, especially in pregnancy, it is important to try to flush your body. And you can also take cranberry juice, and you can either drink the cranberry juice, you also get it in a concentration form that you can drink it. And that also is a more natural way of trying to deal with this. And you also get tablets, cranberry tablets, that actually also work quite well for UTIs. And here again, if one thinks about the tissue salts, I would also say, have a look at the tissue salts, have a look at the different numbers. But the number 8 one really is the one that that does a lot of tricks. Okay, so perhaps by looking at those kind of things as well.